Good day everyone, my name is Dr. David Amron. This is Lippy Logic at the Lippy Lounge. Today we have our guest, Dr. Aria Vazirnia, who is somebody I see actually every single day, I gotta tell you. But we're gonna talk about a lot of great things, interesting things about the ALT method and the program. But I wanna start by telling you that Dr. Vazirnia works alongside me, and we have very many similarities. He is a derm surgeon like myself. He trained at the same place that I trained, which is UC San Diego, which is a great program and a very surgically oriented program. He then did a very prestigious fellowship at Harvard for about a year or so, right? And he also, along with that, we have other similarities, which is tennis and skiing and guitar. You play music also. And I heard your stuff, you're good.
Thank you.
Yeah, more classically oriented, right?
Yes.
He's learned the principles. He's learned my philosophy about things. He's learned all the different aspects of technique and kind of recite them backwards and forwards with things. But I want to, I've talked here. You've been in the operating with me for hundreds of hours with things. You've done cases with me. You're doing your own cases now with things like that, and I trust you to do that with them. How do you feel about the way in which, I guess, you've been trained in this way of doing it and the way of doing it and your feelings about it?
First of all, it's been a very humbling experience to be involved with ALT. The training itself, I can't see any other way to do a training for lipedema surgery other than what we've done together. The surgeries are so specific. It is not just liposuction surgery. It is understanding the pathophysiology, understanding what the patients go through, and then understanding really what fibrosis is and, tackling the fibrosis involved in these surgeries. After seeing hundreds of cases, assisting you with cases and doing my own cases, everything has been so precise. Everything from the markings in the beginning to the insertion points, to positioning the patient to do a perfect 360, a true 360 liposuction approach for these patients. I don't see any other way to do it other than what we did.
I have to say the exact same thing too. I just don't know how to really do things the right way and just say, you've got to really understand every component. It's not only just the surgery too. A lot of it is the pre-care. It's the treatment plan. It's the strategy of how to approach things. It's the strategy of how to approach complicated lipolymphedema patients. And I've said this before, if you're going to take lipedema on as a surgery, you better be versed and skilled in every type of patient, not just your average patient. You deal with very complicated patients, cosmetically and certainly disease treatment also with it. You've got your patients with complicated medical conditions going on. You've got your proper post-care. It's a whole nother thing too. We're constantly refining our approach to post-care in patients and the more complicated advanced patients with things with it. So I completely agree. I just don't know any other way to go about doing this properly or responsibly without proper training. Again, you need to go through an extensive, structured training process with things, right? To be master, and how it's applied to guitar playing, I'll just tie that in with it also. I play guitar for 45 years. I think I'm a really good guitarist. I think I'm an excellent guitarist. There are so many people that are so much better than me, obviously, with things like that. And to be just a masterful level of a guitarist or a pianist or whatever, a painter, it takes thousands and thousands of hours. Even still, then, it's like many things above you can't put your finger on, the artistry and all that stuff that goes into it. But somehow surgery sometimes is not always given the same type of respect, and liposuction surgery. So, I'm driving this point home. It's certainly dear to my heart with things. I care a lot about it, just liposuction itself, just in general, and I certainly care about lipedema patients being taken care of properly with it.
So as both of us as musicians, we both have experience with learning music. So early in childhood, when we picked up the guitar for the first time, or when we were learning other musical instruments, there is structure to learning music the proper way. That's why people have music instructors, to learn the timing, the chord progressions. Everything requires the patience and truly understanding the structure of the music. So playing guitar, playing piano, which is the first instrument I learned how to play, in many ways is very similar to lipedema liposuction surgeries because there's a lot of structure to pay attention to.
There's structure to it, there's harmony, there's chords, there's music theory, you got to learn all that stuff, right? Then you got to get your technical skills to a certain level with things, and then you kind of continue to advance that, then it's the artistry that comes with it. I mean, I think it's very similar to liposuction. I mean, one say, well, why? You know, why? How is it just similar to it? But it really kind of is. I mean, it's such a I find specific procedure liposuction. Every single motion that you're making, every single approach. I mean, you know this in the operating room, what a nut I am in terms of patient positioning, exactly incision point, exactly this position, how you're approaching things. Even my techs, right? Our techs that we work with, how I work with them in terms of supporting the skin, right? So you're always staying in that plane. One of the first things I work with you on is that concept of the safe plane, right? You know, and then the proper preparation of tumescing. Before you start working, the preparation of the tissue with things. It already begins with integrity, and it also all begins with really caring about things, caring about doing a great job, caring about patient care, caring about always doing right by the patients. And that, I think, is the basis of everything. And I've said this before, and Dr. Vazirnia called me a while ago and said, you know, I think I want to actually take on lipedema surgery. I want to actually get involved exactly with what you're doing. I asked him, you know, why do you want to do it? And he said, I just really care about it. It really intrigues me to take this on. And it was for the right reasons with things. And that is the most important thing to me, that a person's heart and soul is with it. And the technical part of it, you actually really can learn if you have the right type of dedication to something, the right type of understanding and training and structure to it, to the point where he is doing masterful work with things, and I trust him to care for our patients with things. Yeah, thank you for being.
Thank you very much.
Thank you. I mean, I'm looking forward to many years with you.
Looking forward to it too.
Great. Anyway, thank you for tuning into that hopefully interesting segment of Lippy Logic at the Lippy Lounge. My name is Dr. David Amron. Thanks so much for watching.